calmly laying out the case for euthanizing children. A brochure in Manitoba with the heading "Made for Children in Teens" explains how a special committee of MPs and senators has recommended allowing euthanasia for what they're calling mature minors. Even more chilling, it states that parents might not be consulted and wouldn't need to give consent. Right beside it, a section on MAID'D for mental illness, reminding us that while 1 in 10 Canadians waits over 4 months for counseling, the wait for MAID'D is only 3. This isn't a one-off mistake, it's the logical outcome of a system that no longer views death as a tragedy but as a treatment. In February 2023, a federal parliamentary committee officially recommended expanding MAID'D to include minors who are deemed capable of making such a decision. Their report concluded that age alone shouldn't determine eligibility for assisted death. Instead, it argued that some minors are competent enough to request their own deaths, effectively removing any meaningful age floor. Dying with Dignity Canada, or DWDC, one of the country's most influential advocacy groups on this issue, has gone even further. They've urged Parliament to lower the MAID'D age to, quote, at least 12, claiming these children should be presumed capable of making decisions about their own deaths, just as adults are. In Quebec, things have already crossed into dystopia. Provincial guidelines now allow doctors to administer MAID'D to patients who are unconscious or mentally incompetent as long as they previously gave advance consent. In defiance of federal homicide laws, Quebec prosecutors have even issued directives to protect doctors from prosecution. The slope is no longer slippery, it's vertical. Then there's Dr. Ellen Wiebe, one of MAID'S most prolific practitioners, who has personally ended hundreds of lives. She describes the work as incredibly rewarding and brags hundreds is good. She avoids calling it euthanasia, reserving that term for pets, and instead prefers the sanitized label of assisted dying. This is how evil enters quietly, with sterile language and bureaucratic indifference. We've replaced compassion with convenience, therapy with termination,